The TransCu O2 is a medical device approved to treat chronic wounds such as venous ulcers, diabetic foot ulcers, and pressure ulcers. The TransCu O2 delivers a continuous flow of low-dose oxygen directly to the wound to aid in the wound healing process. This process is known as continuous diffusion of oxygen. The device is easy to apply, lightweight, and is worn 24 hours a day, 7 days a week. The TransCu O2 has demonstrated the ability to take wounds to full closure for patients who have not responded to other advanced wound care therapies. As a result, treatment days are shortened, thus reducing all the associated costs of wound care such as physician visits, dressing changes, nursing care, and potential loss of income. Over 10 million Americans suffer with difficult-to-heal wounds. Over 1 million people each year develop new cases of diabetic foot ulcers and venous leg ulcers. Over $24 billion in Medicare reimbursements are processed annually to treat these wounds. Finding the right treatment will contain costs and provide patient satisfaction. Eileen and Bob share their story of a 3-year-long battle to close a wound as a result of a hip replacement surgery.
4 years ago, she had a lot of discomfort on her hip, and she proceeded to have hip surgery in Waverly Hospital, and she was spent 9 days there. And in the 9 days, they did some therapy, and they finally sent her home. She got home on a Saturday morning. My daughter was here, our daughter was here, and just overnight we decided it was too much for us to try to take care of her. She was very uncomfortable, and so then she was put into the Grundy Hospital.
Eileen suffered continuous discomfort after surgery and had additional health setbacks and made numerous trips back and forth from the hospital to skilled nursing before finally ending back in the hospital for another surgery to reopen the hip in October 2009, and a spacer was inserted. The wound started healing from the outside in, so on January 19, 2010, the wound was reopened and negative pressure wound therapy was started.
We started going to the wound person in Grundy Center, Mandy, and she was trying all of these different things. Nothing really seemed to work, and at that time the wound was probably about 2.5, 3 inches wide and maybe 2 inches deep, 1 3/4 inches thereabouts. And so finally Mandy realized that what we were using wasn't doing a whole lot of good. So she asked us if we would be willing to try the thing dealing with the oxygen put into the incision. And of course we agreed to that immediately because nothing else was working. She asked us to come back after the first week, and she noticed a little bit of improvement, but not a great deal. And if I remember correctly, she asked us to come back in 2 weeks, and in that 2 weeks' time, we went from the depth that I was talking about a while ago to probably about 1/2 inch. And so we've been dealing with that, and we've gone to the wound doctor to see Mandy a number of times to change this whole process, and I think we just went there yesterday, and I think we're down to maybe 1/4 inch in depth or 1/2 inch thereabouts. So we think the wound thing has done tremendously. Okay. Following the wound vac, then it was required that I change the dressing twice a day, and I continued that probably well over a year. And then we finally went to maybe once a day, and that's what I'm doing. I did that for the longest time, and then since this was put on, it was about once every 3 days.
I definitely feel that if I'd have had the EO2 right away, it wouldn't have been near as long a process, and I would be thankful if other people didn't have to go through the length of problems that I did. And
I might add that, when she first came home, and for up to the time that she, before we put this device on, that she had a lot of discomfort and pain and so on in bed. But now that we have this, why certainly has made a difference. When we first came home, we were limited as to what we could do because we couldn't go every place with the wound vac on. And but now that we have this device on, we think nothing about getting outside in the wheelchair and putting her in the van and going someplace, which we couldn't do before. And we felt like we shouldn't be doing that either because of the cumbersome of the wound vac and the fact that her incision was still open and so on. But we feel quite free of being able to go places now.
Yes, I would recommend that EO2 to anybody that is in this type of situation because it is. It's not painful and it's very easy to wear, and I think it's a good deal.
Yeah, we've been very, very happy with it, and I would recommend it for anyone because if something doesn't heal and you go over an extended period of time, eventually you say, "My, is this ever going to heal?" And we've said that many, many times, and we are at the point where now it's almost healed, and that we can definitely give all of the compliments to this particular device.
Patient health and satisfaction while keeping Medicare costs contained can be accomplished with the right wound care product. Please encourage CMS to supply the proper Medicare code for the TransCu O2 device. Let's start spending wisely on products that work and put patients back on the road to recovery sooner rather than later.
Yeah, we're very happy with it. Very happy.